Today's live chat, we're going to be discussing coccydynia, which is a painful coccyx. This is an incredibly uncomfortable condition to have where sitting becomes a literal pain. And we're going to look at what are the risk factors, what is the evidence behind the treatments, and what can you do if you have this condition. We're also going to look at some of the comments that have come through regarding this condition, and I'll be going through each one and answering the questions that have come through. So thank you to everyone who's commented on the video, and this video will be sent to you. Okay, so let's get straight into it. There's three kinds of coccyx injuries. One is through the trauma, where you actually fall on something and you hit the tailbone, which is at the base of the spine, so right at the in between kind of the top of the bum cheeks. Or there's another type of injury where you have a hypermobile coccyx, which means your tailbone moves more than it should, which means it's more likely to strain. So those are the two common ones. You can also have a few other types of injuries, but it's usually either down to trauma or it's down to hypermobility, or the third one is down to your weight. And if you have a high BMI, if you're overweight, then the research shows that your sitting position is changed, and that affects how much pressure there is going through the tailbone, so that could be causing it as well. So those are the three main causes of coccydynia, and we'll go through what you can do if you do have this. Now, going on to that part, which is the treatment options. Manual therapy is a treatment option, so going to see a physiotherapist, osteopath, who can do some treatment into the muscles around the tailbone to try and get you some relief, and looking at research on mobilizations, which is where they move the tailbone and try and get it free and try and get pain relief that way, or massage around the muscles around the tailbone. Massage and stretching of those muscles seems to be more effective, and I'll link to the research in the comment box below. That's the manual therapy option. Better to go for stretching and massage than it is manipulations. There is also some research on interanal manipulation, where they put the finger in the bottom and then kind of manipulate the coccyx from the inside. Hi, thanks for joining in the live chat. Appreciate it. It's nice to have some company, and that's another option in terms of the treatment options. But there's fewer therapists who do that, so it's harder to find somebody who's experiencing that, and it's also harder to kind of tolerate that. So those are two types. If you have tailbone pain, you can either go down the manual therapy route where they do massage and stretching, or you can go down the manipulation route where they go interanally and manipulate the tailbone. So it is talking about anal stuff. The next option that you have is a steroid injection, and steroid injections are a valid option. If you go to see a consultant, that's probably what they'll do for you, and they may need to do repeated injections if you're in a lot of pain. So those are three options so far. The fourth one is surgery, and the fourth one is either surgery to affect pain, or there's surgery to actually remove the coccyx. Those are the couple of options that they have, and the outcomes for surgery are quite poor, and there's also a risk of infection, so it's not recommended. So let's go straight into the comments, which will be the next part of this Q&A. We have Abijah DIW said, I recently fell and had a sacrococcyx dislocation. I'm 20-year-old female, and it's been 1 month and no progress. So the average recovery time for coccydynia is around 3 months, which is 12 weeks. In that period of time, you can ice the area to get some of the inflammation and pain down. You can sit on a donut-shaped cushion to get pressure off the area, and you can do yoga-based stretches to affect that muscle that I talked about earlier, which is the levator ani. Exercises like the piriformis stretch, the pigeon stretch, pike, all of these will affect that area, and the glute bridge. So those are all really important areas for affecting those muscles that are linked to the tailbone. If you don't have progress after doing that for a period of a couple of weeks, then it'd be time to go to your GP and look at exploring other options, like going for a referral for physiotherapy, and if that doesn't work, potentially getting a steroid injection. So that would be that would be the course of action. You've said your doctors have prescribed you painkillers. Painkillers won't solve the problem. It will address the symptoms, which may give you a window of opportunity so you can do the exercise and do the other stuff that I talked about. But it's a lot. It's going to be down to you, because this is a poorly understood condition. It's not managed really well, so you've got to do what you need to do to get better, and give it time to rest as well. Next question on this was, I'm not sure. Wait, give me a second. I've started this pain continuously sitting on hard surface. X-ray shows it's dislocated from a place. Please help. And that's from Darshan Takere. And sorry if I pronounced your name wrong. It depends on who you got the X-ray from. Chiropractors, from my experience, tend to say a lot of things are dislocated or subluxed, so that they can send you a block of treatment. But that's just been my personal experience. I'm sure every chiropractor is not like that. And if it is dislocated, then that may be down to the hypermobility that we talked about earlier. So strengthening exercises for your pelvic floor will be really important. And there's several of those, including the glute bridge that I talked about earlier. And I would recommend doing that for a couple of times a day, every day, for around 2 weeks, and seeing how much benefit that gives you. If you can heal yourself through exercise, that's the best way, as opposed to going through these other treatments, because there are risks and side effects associated with any kind of intervention. But exercise is relatively safe, harmless, and it's always worth doing as your first line of action. But you've got to stay consistent, and you've got to persist and do it often, every couple of hours. The next question was on, so I'm suffering from coccyx pain since 2 years, age 25. I've tried stretching exercise, but it hurts even more. Doctor advised to remove entire coccyx. Can you help? Can it be healed by applying ice? Applying ice is just to get inflammation down to help with pain, which should create a window of opportunity for you to build it up. You said stretching makes it worse. You've got to find the right combination of stretches and find out where your threshold is. So if someone's like I'm recommending stretches, 3 stretches for 5 minutes each, then you need to cut that down, maybe do 10 seconds and gently going into each stretch. There's always a kind of alarm threshold level, and you can nearly always go below that and then build up gradually, and then retrain the brain to not set off the alarm signals. So it's pain in the area, but there's also a lot of other stuff involved, like the brain. And through movement, you can actually heal that area by gradually starting easy and building slowly. And that's the key. Start easy, build slowly. Next question is sent in by Rizwan Khan. It's really painful. I'm 20 years old, athletic, working in a law enforcement agency, but unfortunately I'm suffering from coccydynia and can't sit for more than 10 minutes on a chair. When you have chronic pain, it's important to manage it. So it may be that you sit for short periods of time, which it doesn't sound like an ideal solution, but for the time being, if you can go below that kind of threshold of what sets it off, you can give yourself a window of opportunity to start to strengthen and condition the area. So an example would be sitting on a donut shaped cushion, sitting for 5 minutes, setting an alarm on your phone, every 5 minutes getting up, stretching around a bit, and then getting to sit back down. And this can enable you to get through the day, so you can keep working, do your very intense job, but still be able to allow your body to recover, heal, as you then do strengthening exercises for the pelvic floor to alleviate pressure on the coccyx. So that's your best bet. The other treatments, like the surgery, are not the best option in the first instance. Somebody, Sunny Benoit, said, I'm a bio lecturer 27. It's difficult to do my job because of coccydynia. If you're a lecturer, absolutely it's going to be difficult. It's important to have periods where you're able to sit and stand, so maybe vary your lecturing, and instead of doing chalk and talk in front of a board, sit for a while, stand for a while, try and get the group to be interactive, give them activities so that you can walk around, apply ice when first thing in the morning and when you get back, to relieve pain, and then start to do the exercises every couple of hours, even if it means going into a side room in an office and then working on the exercises in order to build up those muscles that we talked about to get relief from the coccyx pain. So it's really important. We talked about the 3 causes. Could be hypermobility, could be direct trauma, or it could be because of obesity. If it's obesity, you need to get your weight down, and intermittent fasting, which I've got loads of videos on, is an option for you. If it's hypermobility, you need to do strengthening exercise. That's the only way to get out of that. And if it's down to direct trauma, then you want to just manage the pain. So you want to do things like pacing, taking regular breaks, icing the area, and trying to avoid aggravating tasks by using donut shaped cushion, things like that. So that's your kind of three things to do for each of the possible scenarios. So that Ashish Manhas says, hello, I need to join the army. Coccyx is making it difficult for me. I can't even lift in the gym. I can't sit for 5 minutes to study on a soft cushion. M25, all doors are closed now. Sorry, it sounds like you're really distressed. It sounds like you've been having a lot of problems with this. There's a lot of information missing in terms of how long it's been there, what you've tried so far, so it's difficult to advise. But as we've discussed, the treatment options are pretty much clear. You can go down the manual therapy route, you can go down the lifestyle modification route, the steroid injection route, and then eventually the surgery route. But that's not something I'd recommend. So have a think about it, give me some more information, and let me see how I can offer the best advice for where to go next, and let's see if we can get you through into making that entry exams for the army. And I think Uttam Stenvid, I think that's everybody. I think that's all of the questions answered on coccyx pain. So thank you very much, everybody, for tuning into my live chat. I hope you enjoyed it. I hope you got some benefit from it. If you do have any questions, if there's anything left unanswered, if anything's unclear, leave me a comment in the comment box below. I like questions. Questions only have a hold of you while they're left unanswered. So let me answer those questions for you so you can get out of pain and get on with your life and live pain-free and enjoy life. So thank you very much for tuning in and have a great day.